We currently have record numbers of people dying from heart disease and cancer. We have record numbers of autoimmune diseases, obesity, diabetes, autism, teenage suicides, mental health disorders. I could go on and on and on. What is clear is that the systems that we have in place are not only ineffective at generating health, but are in fact causing a high level of disease and premature death, despite the huge amount of money being spent on so-called health.
Welcome to the Radical Health Rebel podcast with your host, Leigh Brandon. If you enjoy the podcast, please leave a 5-star rating and a warm review. And now, here is Leigh, the Radical Health Rebel, with this week's podcast.
Welcome to the Radical Health Rebel podcast. In this week's solo episode, I'll be entering a parallel universe and speaking as if I'd been given dictatorial powers as the health Tsar of the UK, and discussing what I would do to optimise the health of the population. So I would have carte blanche to do whatever I want to do to achieve the goal of optimising the health of the nation. So it's been clear for many years now that those who are in governmental roles to help improve and maintain the health of the nation have failed tremendously, and it could be argued have prioritised a system that prioritises the generation of maximum financial profits for its stakeholders at the expense of the people's health. So the purpose of this episode is to generate thought and to perhaps start a process of changing the current paradigm that exists around health and the direction that we could move in the future. I also want to say before I start that my ideas will probably be quite radical for most people. However, radical change is required if we are to reverse the runaway train that we currently have of ill health and disease. We currently have record numbers of people dying from heart disease and cancer. We have record numbers of autoimmune diseases, obesity, diabetes, autism, teenage suicides, mental health disorders. I could go on and on and on. What is clear is that the systems that we have in place are not only ineffective at generating health, but are in fact causing a high level of disease and premature death, despite the huge amount of money being spent on so-called health. Now, because the ideas that I'm about to share with you are quite radical, I understand that there will be winners and losers with the policies that I'm going to suggest. Some people will have a lot of resistance to my ideas. I completely understand that, and I'm completely aware that's the situation. But I'm also aware that as humans, we tend to have a natural resistance to change. You know, we like to stay in our comfort zone, even if our comfort zone is illness and incapacity. So what I also appreciate is that with these policies, there will be losers in the short term, but what I would want to have in place are plans to minimize or eliminate any short-term loss. So as an example, when Margaret Thatcher shut down several industries in the 1980s, she left large populations out of work. Now, whether you agreed with her policies or not, what she failed to do was to set up alternative solutions for large numbers of people that she made redundant, who then became a burden on the state and also caused those people a lot of hardship. So I have that very much in my mind as we work through these plans. What I also recognise is that I do not have all the answers, especially the knock-on effects across other sectors that my policies might have. But as I said previously, this episode is all about generating ideas and helping to create a new way of looking at health going forwards. So in this episode, I'll be discussing setting up a diverse health advisory board, conflicts of interest, the mission, my plans to improve health, why the soil is crucial and why we need organic farming practices to be standard. I perform a SWOT analysis on the National Health Service that we call the NHS. my plans to completely restructure the NHS, health education and changing the health paradigm, rewarding the healthy, putting an end to scientific and medical corruption, an overhaul of the safety standards around the use of toxins and electromagnetic radiation generating devices, and an overview of the future health of the nation with my policies in place. Now, as the dictator of health for the UK, the first thing I will do is introduce a democratic process immediately. So I will relinquish my dictatorial powers and seek a range of views and include people I respect to help in the decision-making process. I would therefore set up a governmental health advisory board that would, as a team, democratically make the decisions. So the world we live in today is heading at an ever faster pace into a medical dictatorship controlled by billionaire philanthrocapitalists and mega-rich corporations. That has led to one of the biggest health disasters, if not the biggest health disaster that we've ever seen over the last 2 years. One of propaganda, censorship, psychological operations, corruption, coercion, profiteering, cronyism, and theft from the public purse. So I'm very aware that now I have this huge power as the UK's health czar. What I wouldn't want to do is to repeat the mistakes of the past and indeed our current situation. So I would invite top experts from the UK and beyond to form the advisory board to devise the best possible plans to improve the health of the nation. So I would invite the following experts onto the advisory board. So from the UK, Carl Hennigan, Professor of Evidence-Based Medicine at Oxford University. Sunetra Gupta, Professor of Theoretical Epidemiology from Oxford. Professor Carol Sikora, Specialist in Oncology. Michael Levitt, Professor in Structural Biology. Norman Fenton, Mathematician and Professor of Risk Management. Dr. Claire Craig, Diagnostic Pathologist. Dr. John Leigh, Retired Pathologist. Dr. Asim Malhotra, Cardiologist. Dr. Tess Laurie, who is a Director of an Evidence-Based Medicine Consultancy. Dr. Mike Yeadon, former Vice President of Pfizer. GPs, Dr. Rangan Chatterjee and Bob Gill. Dr. Zoe Harcombe, who has a PhD in Public Health Nutrition. Neil Oliver, who's an archaeologist and broadcaster, a really altruistic man, very good at critical thinking. And I would say the same about my next invitee onto the board, Russell Brand, comedian, actor, activist. Helen Browning, CEO of the UK Soil Association. And then the final UK member that I would invite, someone who I only came across very recently on a Aubrey Marcus podcast, and that's David Charalambous, who's an expert in systems theory, process mapping, dynamics and communication. From overseas, so from the US, I would invite triple board certified Dr. Zach Bush. From Belgium, Dr. Gert van den Bosch, virologist and vaccinologist. Actually from the UK, but now resides in the US, Dr. Andrew Wakefield, former gastroenterologist and now filmmaker. From South Africa, Nick Hudson, who's a private equity investor and chairman of Pandemics Data and Analysis, also known as Panda. So I specifically chose some people because I know they have opposing views. You know, in the real world, we have a situation where people are chosen to be on certain committees and boards, and they tend to share the same view, or some of these people tend to be quite open to being financially persuaded to take a certain view, which is normally the view of those preferred, by those that are in power. And we saw during the so-called pandemic that opposing views to the government were simply not heard. So the only viewpoint that was considered was one that was the policy that was already been decided. Open debate was cancelled, including medical doctors losing their license because they chose to save lives rather than allow their patients to die, which actually went against government policies. Thank you for watching the Radical Health Rebel YouTube channel. If you enjoyed this video, please be sure to share with your friends and family, or share via your social media. Hit the like button, subscribe to the channel, and hit the bell icon to receive notifications of new video clips from the podcast. And if you want to watch the full podcast episode, completely ad-free, plus premium content, and join the Radical Health Rebel Patreon community, head over to the Radical Health Rebel Patreon channel at www.patreon.com/Radical Health Rebel. Thanks again for watching.